Hi guys, so I thought it was time to make my videos on what it was like in the treatment center that I went to over the summer. And I'm gonna try not to say the whole time because I tried to make this video a few days ago and I noticed I was saying a lot, so we'll see how I do. I'm probably gonna make this video into a couple of parts just because it's gonna take a while to talk about all of it, and I'm gonna try not to leave anything out. So I'll give you an idea of how it was kind of set up. So the place I went was called Rosewood Ranch in Wickenburg, Arizona. And so I was there for 32 days, and then after that I was transferred. So that was the inpatient facility. After that I was transferred to what's called an intensive outpatient program. And so I spent, I think, 35 days there, and that was called Rosewood Capri. It was still in Wickenburg, and the main difference of the two was there weren't people like with you all the time at Rosewood Capri, and you made your own meals. So I'll tell you more about that. So let's start with Rosewood Ranch. So there are two main buildings. I'm going to use my hands a lot. First building has nurses station, the rooms where all the patients stayed, an exam room for the doctor to do exams. And the second building was very close by. It was just a short little walk up a sidewalk, and that had the cafeteria and the dining room, the offices for the therapists, and what they called the great room, which was like a big kind of living room where we lounged. So when you first get to the treatment center, it's very similar to like a rehab if you were going for alcohol and drug related issues. So they take your luggage and put it in the nurses station. And so when I first got there, they did my medical exam. Well, first they did the paperwork part and signed a lot of papers. And then we did the medical exam, and they showed me to my room. There were 3 roommates, and they go through my luggage and pick out any sharps. So basically at the nurses station, they kept your sharps. They called it contraband. So sharps like tweezers or razors, hairspray, body spray, anything that has alcohol in it, and any glass. So my foundation I had to keep at the nurses station because it was in a glass bottle. And then I had a little compact that had a mirror in it, so that had to be kept at the nurses station. And they do that because there are people that struggle with self-harming, and so they just want to make sure that everybody's kept safe. When you first get there, usually for, I think I was there for 72 hours. I was under DO. It was called DO, so it was direct observation. So what that means is they're kind of watching you, make sure you aren't purging, which I've never had a problem with, but a lot of people do. Make sure you aren't trying to hurt yourself or, struggling. So you also, while you're in DO, you can't flush your own toilets. And that's just to, again, keep an eye on if you're purging, things like that. Let's see. When you are in DO, there were about 6 people in DO together, and you eat your meals together and snacks. So you eat 6 times a day, and meals while you're in DO, you got 45 minutes to eat, and then snacks were, I believe, 30 minutes. And that was hard because I'm used to eating faster, And whereas a lot of people, especially people that had certain fears about food or had anorexia, really struggled with eating and getting the food down, because a lot of them hadn't been eating in a long time. So once I moved out of DO, I was able to join the rest of the community, and they eat their meals at the dining room that's at the second building. So let's see, in the mornings you have to wake up about, gosh, I think it was like 5:45, maybe 6 o'clock. And we weren't allowed to have alarm clocks, so the nurses would go around and knock on the doors and kind of wake everybody up. So the morning routine, you would go in your hospital gown and stand outside the medical room, and in the morning you would get your vitals. So that means you would get weighed, which of course we never got to see our weight. And then they would take your blood pressure as well as your body temperature. And so that's every morning. And then you would get your medications, and then you could check out your contraband, depending on if you had self-harm history or anything like that. Some people had to have a nurse watch them while they shaved, or even tweezed or whatever. So you could check out your makeup and hairspray. For me, it was the hairspray. That was hard, not having hairspray nearby. I mean, I keep hairspray in my purse, so that was a tough one. Body spray, I also like to use body spray quite often, and I've always felt self-conscious about being a big person and that I'm gonna smell bad, and so I've always had body spray, and I think I brought like 4 bottles with me to the center. So anyway, so we would check out our makeup and hairspray, go back to our room, get ready, get dressed, and then we had to have it turned in by 7. So I think this is a good time to wrap up part 1, and we'll do part 2 in just a second. Bye.